Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today on the show, we have Lalitha Sundararaman. She is an anesthesiologist and she wrote the KevinMD article, Prioritizing Physician Wellness, Reducing Burnout During the COVID-19 Pandemic and Beyond. Lalitha, welcome to the show.
Thank you, Kevin. I'm so happy to be here.
So we'll get into your article in a little bit, but first off, can you just share your story and journey to where you are today?
Well, it's no surprise, I guess, from my last name that I'm from India. And I trained in India. I was working as an anesthesiologist. And just like so many of our immigrants, due to financial concerns, I came over to the US. I repeated my entire residency here. And I started out again, fresh again, as an anesthesiologist. And I've been an anesthesiologist at the Brigham in Boston for the last 9 years.
So when you said that you had to repeat your residency again after coming to the United States, tell me, what was that like?
To tell you the truth, we were left with a lot of family loans, which I was unable to pay in India. And I needed to come to the US so that I was able to pay back my mom's and dad's loans much faster. And it did happen. So that was my chunk of the American dream. And I came over here and I was already an anesthesiologist practicing in India. And I decided that that's the field for me and I want to continue my dream. So I came over here and I repeated my residency here. To be honest, it's really easy the second time. But that being said, it is a stress on family life and it's a choice, which it's always better if you make it as an informed choice, knowing what you're getting into, the hours and the burden and responsibilities which come with it. So when I came to the US, it was a different scenario compared to the scenario in India. So that was a little bit of a different cultural change, and the responsibilities and the you face as an anesthesiologist here are a little different from over in India. And that was all a change I adapted to, and I'm happy in my job. But it does come with certain responsibilities and burden, which only accentuate when you have a family and you have children to take care of. And I'm sure that everybody are well aware that all our responsibilities and the emotional burden as well as physical burden have really increased during this COVID pandemic. And that's what I hope to elucidate during when I was thinking about writing this article, because, this is something which is very, very common, but nobody wants to express it first.
So let's talk about that article, and it's titled Prioritizing Physician Wellness, Reducing Burnout During the COVID-19 Pandemic and Beyond. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
So physician, it's like a different sort of job. It's not like IT where you can, if you do a mistake, you can just simply reboot the computer.
Mm-hmm.
I mean, I'm sorry, I'm kind of simplifying it, but you do have a chance. But if you do a mistake, then if it lands in really significant consequences, you're probably scarred for life. And hence, it's a burden, it's a responsibility, and it's a joy. This profession serves to be all three. And what mixture of what it is depends on you. And hence, sometimes it's a real joy to do the job. And sometimes you come back home and you're thinking oh my God, what kind of a crappy day I have? Why did I even enter this job? So, when I was actually starting out, I was so excited. I was so happy with the job. And as the days meandered by, I must say that, at certain times I was like, oh gosh, do I really have to go to work tomorrow? Especially when the kids are yelling and screaming in the background and you have so many other family obligations, it becomes tedious. And the COVID pandemic actually brought on a whole new layer to this problem. And there were days, just to be off the cuff and tell you, in the whole middle of the COVID pandemic, one day, night at Sunday, 9 o'clock, my nanny texted me saying that she doesn't want to come to work again with me because she's so scared of getting COVID from me.
Mm-hmm.
And I was like, really, guys, I go to work. At that point, nobody was vaccinated, right? You take all the stress, you're trying to help people, and then suddenly you landed up with problems at home, which you're unable to face. And you got to somehow face it and move on. So that really adds to your emotional burden. And I was like, if I'm going through this, I'm sure a lot of other people are also going through similar situations, but they're just not able to talk about it or think about what to do about it. So, hey, why not talk about it, gather more opinions, and probably give some ideas on what can be done to tackle it. And that's how the article was born.
So tell me, in the midst of the pandemic, that day that your nanny texted you saying that she didn't want to come in because you were an anesthesiologist, walk us through that day and a few days afterwards in terms of the emotions that were going on and what was going through your mind during that time.
So it was a Sunday night. The next day was a Monday morning. We had all the usual, ideas about, what kind of lunch to prepare for the kids, how to pack stuff, what kind of dress she's going to wear tomorrow,
Hmm.
mundane stuff like that. And suddenly at 9 o'clock at night, while reading up on my epic talks and basically like trying to like think about what case is going to happen tomorrow, what are the comorbid conditions, and then suddenly I get like this pop-up text message and which says like, sorry, can't come from tomorrow. My son advises me not to go to work.
Hmm.
And I was like, I was completely shocked. And it's like, are you okay? What's happening? And she said, no, I'm fine. We are afraid of getting COVID from you.
Hmm.
I was like, there was this slight moment when I almost felt like a leper. Like,
Hmm.
what am I? Am I carrying some disease that, you know, why am I not entitled to like help in these difficult times like everybody else, but expected to help from my side? Is it fair? There was that one moment of like real frustration because you're expected to help as a doctor
Hmm.
and you have no solution, you have no way out. It's what you're supposed to do because you took the Hippocrates oath, but then nobody else does that back to you. So there was that moment of lingering frustration. And then my husband said, like, just, hey, jump out of it. Let's see how we can tackle it. Maybe I can work from home tomorrow. Then we'll see whether we have any backup options. We'll call the Brigham backup service. We'll call care.com. We'll check it. We'll see what happens. So, he actually helped me get through that. And then I also did a whole bunch of night shifts
Hmm.
so that during the days I could take care of my kids and family. And during the nights, I was on the airway team, the Lions team, and the respiratory therapy team and the ICU teams. So that kind of helped us to get through the day. It was really tiring at points because of the nights and days, but we managed to get through it. And I'm sure the same situation happened for a whole bunch of my colleagues everywhere across the world. I'm probably being more vocal about it, while it's probably a kind of simmering inside for them, and that's it.
So as you were feeling burnt out because of family stresses, life stresses, and of course stresses with COVID in the hospital, what are some of the things that you did to address those feelings of burnout?
Thank you for the question. That's a really important thing. So, for some reason, a large study has come out saying that women anesthesiologists and, in fact, women doctors during the COVID pandemic have actually experienced greater rates of burnout compared to their male colleagues. But when they have supportive spouses, they actually experience less burnout. And that's been kind of quoted in my article along with references. And it's actually been a very similar situation for me too, because if I was to experience all this alone, I would have been far more stressed. And I'm really lucky to have a supportive husband who actually helped me through many of the family stresses. And, that's actually most of the core lies there. Your family support is really core to getting you through these difficult times. But hey, all of us don't have supportive families, and the next step would be our friends and our
Hmm.
immediate circle. So that's one thing. We actually, formed a group chat. We had like group Zoom meetings to just kind of like vent and find out without like any specific names to kind of like de-stress. And usually what people do is they kind of meet up after work, like, hey, let's grab a drink at the bar, or like, let's kind of meet up at the weekend with our kids at the playground.
Hmm.
Those are simple things. And me, I actually did quite a few of those. We met up at the playground because it was an open space. And then while our kids could play and they had like some limited amount of socializing in the open space, we kind of met with our masks on and at least chatted to kind of like relieve our stress, which really helped. And then, the Brigham also and the ASA have many resources to kind of help you with burnout. The most important thing is to recognize that this is happening inside you. Most people feel like, oh, this job no longer has any appeal for me, or, this is the same old, same old. It's not exactly like that. Maybe it's not just a job, maybe it's what you're feeling towards a job. You started out with so many good intentions, right? And there's a reason why you went into this field, because you really like it. So if you no longer like it, you should revisit the causes and consider what it's happening inside you. So if it's like stress, if it's like any other, disappointment or lack of promotions or anything which is causing burnout, then that should be identified and you should be ready to recognize the symptoms. That's the first step. And then the next step would be to manage it on a personal, social, and institutional basis. And those are the ideas that are given in my article. Personal basis would be meditation, using any apps like Headspace, listening to
Hmm.
music, anything which you want to de-stress yourself, or social interactions, which can be any way you want, Zoom, FaceTime, or even just like a walk outside. And then the second step would be social and limited social interactions on the outside, as well as exercise activities. It has been proven that even if you do 10 minutes of stretching and exercise every day, it actually helps to decrease burnout. And when you consider that about 50%, 46% of anesthesiologists, even before the pandemic, were experiencing at least one symptom of burnout, and that has risen to like 60 to 80% now, then that's a pretty significant number. And if this can be reduced, we can really preserve our workforce. 50% of anesthesiologists here and across the pond in Europe have actually decided to reduce their work hours after the COVID pandemic. So we're going to lose a considerable number of our workforce. So any step that can be taken to decrease the stress and improve our work hours would probably be better. And one step would be exercise. A simple exercise like 10 minutes of stretching every day, or 10 minutes of yoga, or like 20 minutes of cardio can actually help to decrease burnout, release endorphins, and actually help you experience more pleasure in whatever you're doing. And then the last step would be actually institutional support.
Hmm.
So the institution also has to pave the way for you to, have a streamlined method of working. What do I mean by that? Like all of us use, Epic, Cerner, many other methods of computational work, electronic medical records, right? And many times we go home and we do all the electronic medical record
Hmm.
work at home. But that's not what we're being paid for. That's not what's expected that you're actually doing. Nobody even recognizes that you're doing all this work at home. You're answering emails, you're answering patient messages, but sometimes that just spills over into your family life and personal time, and that adds to frustration. So, in some institutions, they've actually given you dedicated time during the day to answer telephone calls, to like take care of electronic medical records, and that could be something which is incorporated into the day as well. And another way to decrease the stress that you have for computational and other administrative work would be to have people like medical assistants or
Hmm.
PAs who can take a part of that work so that you can actually concentrate on what is important, namely clinical work. And that's what you were trained to do, that's what you like to do, and hence it might be actually a better way to actually do things. So those are the ideas that I've actually given in my article, along with some references as to studies as to which have been done, what have worked. And just decreasing administrative work in one study has decreased burnout from 58% to 13%. And that's like a remarkable number by any standards. And there are many other methods which can also work on a personal level, but you have to be patient to try them, give them time, and give yourself time for everything, for your personal life, for your own sense of self, and your sense of being a doctor.
We're talking to Lalitha Sundararaman. She is an anesthesiologist, and she wrote the KevinMD article, Prioritizing Physician Wellness, Reducing Burnout During the COVID-19 Pandemic and Beyond. Lalitha, I want to talk about institutional buy-in. So you mentioned some of the ways institutions can help with physician burnout by giving them dedicated administrative time, by providing resources, or having the medical assistants take a lot of the more non-clinical tasks. So as a physician, if their institution isn't doing any of these things, well, how can they ask the institution or hospital to implement some of these ideas that you suggested?
That's a very good question because I think it's going to be most pertinent. Everybody's trying to reduce the number of healthcare personnel and make the existing personnel work more
Hmm.
in these times. So the best way would be to like present your C-suite or whoever's in charge with facts. Say these studies are existing, and like it's going to end up in decreased productivity, and hence is going to end up in decreased efficiency, economic efficiency, and hence decreased return. And that's probably one thing which everybody in the C-suite will understand, that eventually if you're going to burn out the personnel which you have, more people are going to leave, and the people who remain are going to be less productive. And hence, you got to learn to take care of the people who you have so that they can produce and be more efficient. The best way to do that would be to like probably access some of the resources mentioned in the ASA suite, as well as the article about what will be the methods by which the institution can implement improved efficiency and streamlining of the resources to increase productivity. And if that can be actually mimicked in their own institution, this can result in less people leaving because there's so many jobs out there now. And this can therefore result in their own improved productivity.
So you mentioned resources both at the Brigham in Boston as well as the ASA, the American Society of Anesthesiologists. Tell us about some of these resources that you mentioned.
Correct. So many of the apps for your own sense of personal improvement and for decreasing your level of frustration, like Headspace and everything, and some other spaces like Mind, are all like sponsored by many institutions and also available. Some of these are also available through the ASA, and hence that could be a method of de-stressing yourself, as well as there are certain resources which are available for one-to-one counseling in many institutions, as well as there's like a wellness initiative which has also been started by the ASA and also many institutions whom you can contact if you have any personal issues, so that they can also work around that and basically help you to be more productive. So one thing is that if you know that you're being listened to and somebody's out there who actually cares, that really helps in decreasing frustration and improving productivity. Even if, like, the solution is not yet in sight, but if you know that somebody's working on it, if you talk and improve relations with your manager as well as the person who's like in charge of your own department, and kind of make sure that they can help you personalize a track, like, hey, I want to work these 4 days a week, I'm willing to work extra hours, but the other 2 days I got to go home and take care of the kids, things like that. If there's somebody to like direct these wellness initiatives, which has been started in many institutions, like for example Johns Hopkins, Cleveland Clinic, at the Brigham, then that would really help to decrease frustration and improve productivity.
And my final question, what are some of your take-home messages that you want to leave with the KevinMD audience?
I think my main take-home message is don't be afraid to recognize your burnout. It's not a problem with you. It is sometimes a disease. And like any disease, we have to diagnose and treat it. Don't be afraid to recognize it. Don't be afraid to ask for help. And don't be afraid to try different methods of help till you feel better. And that's it.
Lalitha, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you. Thank you for having me.